Okay, so I'm going to check my medical charts, and I see that there's a doctor's order for a urinary cath insertion. So what I'm going to do is hand hygiene, and I'm going to put on proper PPE, which are my gloves. And then when I enter the room, I'm going to close the curtains, and then I'm going to approach my patient. Hi, Miss Johnson. My name's Matthew. I'm your nursing student today, okay? I'm going to check your ID band. Can you please tell me your name and date of birth? All right. And Miss Johnson, today we're going to do a urinary catheter insertion, okay? This just means that we're going to do a procedure that'll empty out your bladder and bring you relief. Okay? So I have all my equipment gathered, and I have my trash receptacle near me. I'm going to put my patient up to a working height. Alright, and so I'm going to put this bath blanket over Miss Johnson. Okay, now I'm going to pull down her linen. Okay. All right, Miss Johnson. So what I'm gonna have you do is I'm gonna have you bend your knees, okay? All right. So just going to bend your knees. So. Good. Then I'm going to put chucks under her. Okay, and I have clean water and a skin cleanser applied. All right, Miss Johnson, I'm gonna clean your private part, okay? So, you wanna get the farthest? And Miss Johnson, are you allergic to any iodine or any latex? Probably should have asked that earlier. This is a very private moment. I should not make small talk. But she is not allergic. I'm sorry. She's not allergic to any iodine. Or she is allergic to iodine. Okay. And now we are going to dry her off. Okay. I'm going to remove the chucks. And then I'm going to remove my gloves. Perform hand hygiene. Now you're going to bring out the catheter tray. I'm going to make sure this is, try and give it as much space as possible. So. Down like so. I'm gonna roll this. Okay. I'll break it down. You want this by your arm, alright? So if you just hold that for me, thank you. Okay, so I'm going to maneuver this to where the first flap is away from me. Pull that. No, I misinterpreted that. It should have been the one that's front. You know what? It's okay. Sorry. So I'm going to pull that one. And that fold. And I believe I broke my sterile field by grabbing the inner part. It's my mistake. Okay. So I am going to manipulate it to where it will fold into a square. That will give me more area to work with. So now I'm going to try and grab my gloves. That was not a good to pick it up. So I'm struggling right now, but it's okay. So and that. Okay, now that I have my gloves, I'm going to put on my first sterile field. I want to make sure it's not touching my arms. And so this is the shiny reflective side, which will be going down. So you want it like that. Make sure you don't want to touch the legs. And then drop it. Okay, I'm going to manipulate it. Get under best as I can. Now for the second one. Again, don't let it drop. Make sure not touch anything. Okay. Yes. Okay, same thing. Like so. And since this is a female patient, we do not need this. This is for male, so I'll be putting that here. And so since Miss Johnson said she is allergic to iodine, I'll be discarding that. Let's see, I'm going to remove this, put it here. Okay, and I'm going to discard this since I will not be needing a specimen. Or, let's see, I will also be taking off this. I will be uncapping my syringe. And I will be removing the top, the covering for the catheter. Okay, so now I'm going to unfluffen. I don't know if that's a word, but I will be moving my cotton balls so they're fluff and not attached. Okay, and I will make sure everything is properly prepared. So the syringe will be put here, like so. Okay, so I will now open my hydrogen peroxide and pour it onto the cotton balls. Discard that. Now I'll be opening my lubricant, applying it here. Discard that. And so I will now be cleaning with hydrogen peroxide. So I'll pick this one up. Fry this one. Oh. I will now be using my hand to spread the labia. So one down. Should probably be having longer strokes down, but so like that. Okay, since we no longer need the forceps, discarding that. And so now, Miss Johnson, we are going to do the insertion part, okay? So I'm gonna make sure to bring out this. I want to be careful about it. So what we want to do is we want 1.5 into the lubricant. Then we're gonna take this out. Just be careful. All right, Miss Johnson. On the count of 3, all right? And I want you to bear down when I say, okay? All right. 1, 2, 3. Okay, and at this point, urine would start coming out of the catheter. So I would bring the catheter 2 to 3 more inches. So, and if there is any resistance, I would twist the catheter and kind of manipulate it. Okay, so now I'm going to fill up the balloon. discard that. So now I'm going to gently pull. All right, there's resistance, so the balloon is now in the bladder and anchors to it. So I'm going to kind of make some space and use a belt to keep it. So you want it in between? Like so. And then I'm gonna open this up. I want to make sure to be careful. So I'm now going to put this on the side of the bed, the part that is not moving. Okay. Now I'm going to remove all my equipment. Okay. And that's it, Miss Johnson. So I would bring up I would bring the linen up and take off the bath blanket, and I would come back when I get a doctor's order to remove the catheter. So I would do the same process as first off, I forgot to take off my gloves at the end of the procedure. So let's just say I take off my gloves and do the hand hygiene. Okay, so I enter the room, hand hygiene, proper PPE, I provide privacy, and I've already identified my patient. Hi, Miss Johnson, it's Matthew again. I'm back to remove that catheter, okay? Okay? And in this situation, I know it doesn't look like it, but I would have the linen over her and the bath blanket removed, but just for the sake of time, I would have it like that, so. And so I would have gloves, which I have gloves here. Always gotta stay prepared. So I would put on gloves because now I'm going to give perineal care. So, bath blanket for privacy. I would put her back into system. I would empty out the bag to check how much urine is in there and if there's any specimens I need to collect. So now I'm going to get my bath, which is full of warm water, cleaning, cleansing, skin cleansing. Make sure the starch pad under her. And now I'm going to provide perineal care. So, no, this is after removal. I'm so sorry. God, man. I apologize, Professor Moelle. I'm good at this, I swear. Okay. So sorry. Okay, no. So after removing the urine, I'm going to place it in the middle of the bed. Ignore this. This was never there. And I'm going to unclip the catheter and take off her okay, and my syringe. Alright, Miss Johnson. So I'm gonna remove that well, I should probably take off remove the balloon first, but so Miss Johnson, I'm going to remove the catheter now, okay? So when I say on the count of 3, I'm gonna have you bear down while I remove it. Okay? Okay. All right. You ready? Okay. Count of 3. 1, 2, 3. So she's bearing down, down. Okay. That's we are done with the catheter. So now we will move that. Well, we'll keep the chucks on and provide perennial care now, just in case she has any leakage or urine. So gonna clean. So, right. Come on, new side. Left. More time. Okay, and we're gonna drive her off. Make sure not. Okay, now we're done with that. We would remove the catheter. Alright, Miss Johnson, now it's time to focus on you getting comfortable, okay? So now I would put the linen over her, and I would lower the bed, and I would put a call light next to her. And that is it.